There's yellow, and yellow, I'll get to that, is here. If you're labeled a yellow, then you have to go to 50% capacity, 25 people maximum indoor, outdoor. Businesses remain open. You can read the chart. You can see orange here, the restrictions and the capacities intensify, the capacity limits get lower and the restrictions build. And then red is where we absolutely don't want to be. That's basically a shutdown like we experienced before. So the two metrics that make you a yellow, orange, or red include 3.5% positivity rate for 10 days. I'm going to back up one slide, and you can see the positive test rate for Oswego is 7.7%. So again, 3.5, we're at 7.7. We've been there for a long time, so we meet that metric and blow it out of the water, not only for a yellow zone, but even for orange and red zones. Orange zone is 4.5, red zone's 5.5. The other metric is the 15 cases, new cases per day, per 100,000 residents. So if you meet that 15 cases per day, you go into yellow, orange, red. Back up a slide, you can see we're at 52.6 new daily cases, so we blow that metric out of the water, and we have been doing that for weeks now. So we meet both metrics. There's your guidance again. And we need to practice social distancing and change our behavior to try to work our way out of those metrics. We're going to answer questions about why we're not a yellow, orange, and red in a few minutes, because I had a lot of questions submitted about that, and I'll talk more about that. But the fact of the matter is, we are dangerously close to being labeled a yellow, orange, or red zone. That's just a fact, and that brings more shutdowns just in time for the holiday season. And that's not something our economy can support, and really, more importantly than that, that's not where our data should be. So, let's celebrate this holiday season COVID style and COVID free. That means wear a mask. You know the rules. It's just a matter of if you want to follow them or not. Wear a mask, wash and sanitize your hands frequently. Practice social distancing, the 6 feet rule. Keep your gatherings small. I want to talk about this just for a second because I think people like to fixate on this one. The number 10 is what the governor placed on gatherings, and I wish he wouldn't place the number on gatherings, because the number 10 gives people something to point to. The message should be keep your gatherings as small as you possibly can. Keep your circle small. Keep it to your household. When he says 10, it just prompts people to say, we will not be enforcing 10. And I think that number, people get lost in the number and fixate on the number and miss the message. The message is keep your gatherings small. Try to keep it to your inner circle in your household. And this is a bullet point that I add in, and a lot of other elected officials don't, but I like talking about this, and it's limit or avoid malls and large retail stores. I still don't understand why people take the whole family into Walmart. I still don't understand why they go to Walmart 2-3 times a week. We'll talk about Walmart in a little while because I have some questions about Walmart, but avoid places where a lot of people go. Walmart, hundreds, perhaps thousands of people go every single day. You touch the same doorknobs, you walk down the same aisles, you're walking on the same floor, you're going through the same checkout line. Your odds are significantly greater when you go to places like Walmart, where a lot of people from the community go on a regular basis. So I want to drive that point home. Here's the reasons to do the right thing. It's to protect your own health. As you know, it's to protect the health of others, including your family, your friends, your neighbors, senior citizens, the immune compromised, doctors, nurses, frontline workers. We have a lot of them who live here in the city of Oswego and working at Oswego Health, and our first responders. They all matter. They are all working hard and trying to help us out of this pandemic. And if my point is, if you're not interested in your own health and you say, well, I'm 30-year-old male and I'm healthy, and if I get COVID, I'll just have to sit inside for 2 weeks and it's really not a big deal. More power to you. God bless you. Bad attitude, but I guess that's up to you. But if you don't do it for yourself, do it for others, and do it for the people that I've listed there: family, friends, neighbors, the elderly, and the vulnerable, and our frontline workers, because they're in a different situation. And if they get COVID, the outcome can be drastically different. And there's folks that very unintelligently say, well, it's a 99% survival rate, which is debatable, but even outcomes that aren't death are different. Some people get very sick and end up in a ventilator or the ICU. They could have permanent disability with their lungs and so forth if they contract this. So everybody's different, and you should take that into account. And again, that's if you don't care about your own health. You should care about the health of others. And then lastly, prevent more restrictions. I find it incredibly entertaining that the people who are against masks and say that masks are foolish and we shouldn't have to wear them and I'm not wearing them, and the people who say, well, the rule is don't invite more than 10 to your house, so I'm going to invite 12 and nobody's going to tell me what to do. They're the same people who are equally as passionate and resistant to economic shutdowns and more restrictions. They're the people who absolutely hate businesses and the capacity limits lowered, and you can't have it both ways right now. So if we do the right thing and practice social distancing and the masks and limit our travels to Walmart and frequently traveled areas, we can try to correct this data and move in more favorable direction away from more restrictions, lockdowns, and shutdowns. If we keep acting like it's business as usual, we'll eventually be labeled a yellow, orange, and red. And you won't like the outcome of that either. Here's some reasons not to do the right thing. As I said, you don't care about yourself, about anyone but yourself. You're just interested in being a contrarian, and maybe you like economic shutdowns and more restrictions. They're about the three scenarios I can think of for reasons not to do the right thing. I want to pivot for a moment and give a shout out to President Deborah Stanley, Pam Caracoli, and the folks at Oswego State, and also Upstate, SUNY Upstate. Last week, just before Thanksgiving, we announced that we're testing our essential city employees. That means wastewater, water, fire, police, and DPW. That wouldn't be possible without the help and support of Oswego State. I actually contacted President Stanley because we were concerned about the city workforce, and some city services need to be administered no matter what happens. That includes the departments I just mentioned. And I wanted to protect our workforce and ensure those services continue. And the only real way to do that is to test our employees, essential employees, regularly. So I reached out to Oswego State because they had already an established aggressive testing infrastructure, and asked if we could essentially piggyback off of their program. And President Stanley graciously said, of course, and put us in touch with SUNY Upstate, who really administers the whole program to begin with. And they couldn't have been more helpful, and we launched that testing program, as you see in the photos, on Sunday, and it's gone really well. I'd like to give a special shout out to the Oswego Fire Department, who we've tasked with administering all the tests on behalf of the city. In particular, Chief Chago, his assistant Chief Chago, has done a great job, and this is his number one task every day. It has been for the past month or so, and will be for the next 1 or 2 months at least, so or beyond. And Chief Griffin has done a great job staying on top of the virus from the get-go and really acting as the contact point for the city in administering our response and approach to the virus. Going to pivot again quickly before I get to the questions. This is an announcement that I would just like to use this forum to make. We made this yesterday, and we're trying to support our small businesses through this tough time, and hoping to avoid that shutdown and try to get them through. What we're saying is we used some funds that were sitting in an account from the Oswego City Revitalization Corporation. We took about $10,000 from the one account, which isn't from the operating budget, and used that to develop this Shop Local program. It's basically a gift certificate. If you come into the Economic Development Office and put $25 down, you get your $25 gift certificate, and then you get a second gift certificate. That's what you get as the customer. And then at the same time, we reached out to now over 50 local businesses who have agreed to accept those gift certificates. So you pay for your item with the 1 or 2 gift certificates. The city will use the funding to make the store owner whole, and then you get essentially a $50 item or a $25 purchase for, you have $50 when you normally would only have 25. So it's a really cool new program. I'd like to thank the Economic Development Office who thought of this program and created it and implemented it today. And you can get those gift certificates tomorrow, Friday, and Saturday. We're limited to 400, so if you want them, 1 per person, you'll have to get them in a hurry. The point is to shop local. Shopping local is economically the best thing to do to support business owners right now who are having a rough go of it because of the restrictions and because of the reduced activity. But it's also, as I mentioned, the healthiest thing to do. Big box retail stores, they aren't enforcing masks. They don't have one-way aisles. They don't have space checkout. Our small business owners, and if you don't believe me, just walk around downtown. They enforce masks. They have hand sanitizer as soon as you enter. They have space checkout, and they take the distancing measures seriously. So the safer option is to avoid malls, avoid large retail stores, and shop local, and you can use this program to do it and save yourself some money. That concludes the brief presentation I have, because I wanted to hurry up and get to some questions. So, as I said, these questions came in. We established an email and a phone line earlier today. So people wrote in or called in their questions, so I have them here in front of me that I'll go through in the order in which the email account and phone received them. So if you emailed later today, your question will be down a bit, and then feel free to, as I said, write into those under the comment thread here, and we have Chief Griffin who's writing down the questions, and he'll hand them to me once I get through these. So first question, as I mentioned, is from Sarah T, who asked, why is Walmart not enforcing masks? I don't know why Walmart isn't enforcing masks. I know that we've told management over and over and over again to do the right thing, and this goes back to March when we actually had social distancing enforcement details and mask distribution drives in the lobby of Walmart. I know that corporate Walmart has come out and said that they're enforcing the mask mandate, so it falls on the local stores to enforce it, and we've asked Walmart time and time again to get serious about this. What I'll say is, if you're concerned about why Walmart isn't enforcing the mask mandate, we'll do on our side what we can do to get them to enforce it in an effective way. But Walmart cares about the money they're making on any given day, and if you decide not to shop at Walmart because you're uncomfortable with folks in the store without masks, that's one way to get Walmart's attention, to just stop going, and they'll notice pretty quickly. And then also, peer pressure goes a long way. So, I have a soft spot for the employees of Walmart who are tasked with addressing a maskless individual, because the maskless individual often gets hostile and combative when it comes to the mask for whatever reason. So I would just suggest, rather than relying on the employees to enforce it, peer pressure outside of Walmart goes a long way. If you have that contrarian neighbor or friends or whoever, family members maybe, who just hate masks and are combative and hostile and passionate about it, maybe explain to them why it's important, and you can help out the greater community when it comes to enforcing mask wearing. So that's a good question, and I'm glad other people are noticing about the lack of enforcement on masks at Walmart. Second question is John L. And this is a really good question. He asked, I've been trying to get tested but can't. And well now is at least a 5-hour wait or longer, or they just don't answer the phone. Where else can you get tested besides well now? Oswego Health has testing, and there's actually a well now in Pulaski. They're really the main testing sites here in Oswego County, so I would divert your attention there. However, I would like to point out, because this was a common question, a few weeks ago, testing was administered on a first-come, first-served basis. So you really could get tested if you wanted to. You could show up and have a pretty good shot at getting tested. However, because case data nationwide, the number of active cases nationwide in New York and in Oswego went through the roof, there's a testing shortage nationwide, not just Oswego City, not just Oswego County, not just Central New York, but nationwide. So folks who give the tests had to go in and prioritize who gets a test. So now there's that system. So if you're just somebody who decides today you want to get tested because you want to see what it's like, you're going to be on the bottom of the priority because other people take priority. The symptomatic who may require hospitalization take priority. Symptomatic patients who may not require hospitalization but are showing signs are the second priority. Local people who are asymptomatic but were exposed or in contact with a known positive, they take priority. And then asymptomatics who travel because of the governor's travel requirements. The governor said a few weeks back that if you leave the state, you need to get tested, and you need to get tested when you come back. If they're trying to comply with that, they take priority. So there's really 4 different levels of priority before somebody who decides today that they want to get tested and without, I don't want to say without a reason, but without being told to get tested. Certainly if you're near a positive or exposed to a known positive, or you're showing symptoms, you can get tested. You contact your doctor, you contact Department of Health, and they can certainly get you tested. But they put priority on people who have a reason to get tested. I hope that's as clear as I can make it in a fairly short amount of time. Third question, Barbara C. Okay, I mentioned this earlier. Why aren't we in a yellow zone yet? So let me just reverse the slide. There's the yellow zone. Let me just make sure. So there's the yellow zone, and the yellow zone, to get labeled a yellow zone, you need to have the 3.5% positivity rate for 10 days, and then you need to have the 15 new cases every day for 10 days or 7 days. You'll see we're blowing both of those metrics out of the water. So back to your question, why aren't we in the yellow zone? That's because the governor, some time ago, I can't remember if it's days or a week or so, he came out with more metrics. The 2 metrics that I just talked about are the primary metrics. They're the big ones you want to notice and pay attention to. That's why I like this website. But other metrics include hospitalizations, the geographic area, the demographic of who is positive and who isn't. So a couple points there. You'll see in Onondaga County and almost every other county, they actually break down the number of positives by age. So from 20 to 30, you can see how many people are positive in the day's report, and so on and so forth. So the state obviously cares, and everybody should care, the behavior of the virus and who is contracting the virus, because who is contracting the virus determines who will need hospitalization and how severe that situation will be. If it's young people, we can handle young people. If it's older people, they're going to require hospitalization and care, so that weighs on the healthcare system more. So that goes into consideration when being designated a yellow, orange, or red zone. And then geographic area, I think, is the other one, I'll say, kind of saving us from being labeled a yellow, orange, or red zone now, because we're a rural county. It's looked more favorably than a dense big city, so I think that helps. But that's why we're not labeled that yellow, orange, or red zone yet. We're certainly meeting the 2 metrics. The data's moving in the wrong direction. We are on the verge of being labeled a yellow, orange, or red. It could come at any day. The governor mentioned today maybe some new metrics or a new form of determining who gets labeled what on Friday, so we're going to pay attention to what he has to say on Friday. But the bottom line is, if our behavior doesn't change, then our case data won't change, and if the case data doesn't change, we'll be labeled one of these colored zones here any day. So it's a matter of time. But there's some of the other metrics that go in and impact whether we're labeled. That color-coded determination comes from state government. That's not a decision I make. It's not a decision Oswego County makes. It comes down from New York State. Chris asked if I'm quarantined because someone I was around is positive, but I haven't been tested but want to know, can I get tested? Goes back to the couple of questions ago. If you are being quarantined because Department of Health quarantined you, then you can assume you're positive. You should assume you're positive. That's why you're being quarantined, rather than try to determine if you're positive or not, and there's maybe a shortage on tests. You just go into quarantine because it's better safe than sorry. Take you and put you there for the 14 days to totally eliminate any possibility of you being positive and exposing other people. And that gives Department of Health a chance to catch up on social tracing. If everybody who's near a positive and is exposed to a positive just continues to live life as normal, the Department of Health will never be able to catch up on social tracing. And the case data and the other data will just spiral out of control. So to answer your question directly, if I'm quarantined because someone around is positive, but I want to be tested just to know, can I get tested? The answer isn't whether you can get tested or not. The answer is just assume you're positive and quarantine. And then again, if I want to answer the whole question, but I just want to know, can I get tested? You can get tested, but it's going to be part of a long series of questions that you'll be asked by Department of Health. So when you think you're exposed to a positive, or if you were around a friend and they became positive days later and now you know you were around them and you're not sure what to do, if you were to call Department of Health or your primary care doctor, they're going to ask you a series of questions. I know this because we do it as a city to our employees. We say, what was the type of interaction you had with the person? Were you shaking hands? Did you give them a hug? Were you sitting in a car together? Were you sitting away 6 feet away at a desk? Were you wearing a mask? Did you sanitize your hands? All of that context goes into making that determination. So, if Department of Health or your primary care doctor thinks your interaction was serious enough that you require a test, they'll test, but generally they just order you quarantine because it's the safest thing to do, it's the right thing to do, and it gives the social tracers a chance to catch up to the situation going on countywide. This question is similar. Larry W. asked, I know some people who were quarantined but were let go after less than 14 days. How does that happen, and why is it not 14 days? This is a really good question because I know it's confusing a lot of people. The CDC a few days ago reduced the time period from 14 days to 10 days. However, New York State and the Department of Health, they still honor the 14 days and haven't adjusted to the 10 days. The reason why there may be some situations, I don't think it's common, but the reason why there may be some situations where somebody was quarantined for, let's say, 11 days and then they were able to return to work or cleared by the Department of Health is because the virus behaves differently in your body. So, and I'll lump this question together with a question. I know somebody who tested negative and then tested positive a couple days later. How does that happen? And then they call into question the integrity of the testing and so on. So I'm going to make a diagram quick. Because the virus actually takes time when it gets in your body. It's called the incubation period before it registers on a test. I don't know if you can see that, and if I knew this question was coming, I'd be more prepared. But you have 14 days that I tried to draw out, and then you can contract the virus here, and it can not show up in a test for 3 to 4 to 5 days, and then the virus gets active in your body, establishes a presence, and then the test will register it in 5, 6, 7, 8 days, and then it actually can possibly drop back down depending on the individual again. So that's why occasionally, if you are no longer contagious and have overcome the virus as it existed in your body, you can be let go. It's usually not more than a couple days, if that. That is really not, it's really rare. But, and then this is also why you can be tested if you think you were exposed to COVID on Thursday and you go to get tested on, let's say, Saturday. You can produce a negative test because the virus hasn't, I'll say, come alive in your body yet. But then if you go back on, let's say, Monday or Tuesday, you can produce that positive test. That's just another tricky part about the testing that a lot of people don't understand. And that's why when you encounter these stories, these scenarios where there's appears to be, from your perspective, inconsistencies, there really isn't inconsistencies. It's just a matter of finding the exact situation in the context, and everybody's different, and trying to nail down that scenario and react accordingly. So I hope that kind of clears those few questions up. Stacy asks, will restaurants in Oswego be closed again soon? Well, as I said, the governor said something today that caught my attention. It sounds like different metrics or a different type of gauge is going to be discussed Friday, so we're going to keep an eye on that. But it goes back to the color codes. I'll get back to the relevant slide one more time here. This is all data driven. The two metrics that I talked about, and then a couple extra metrics. The 3.5 positivity rate, we're way above that. 15 cases a day, we're way above that. And then geographic location, hospitalizations, etc. If the data doesn't correct, the businesses can be shut down again. If the data corrects or moves in a favorable direction, we should be in good shape. So it's really just it's going to be a product of our behavior and how we impact the virus locally and the behavior of the virus. What I will say is this, because for the last 3-4 weeks, I feel like people have come up to me and said, you know, oh, are we going to get shut down Friday? Are we going to get shut down Monday? How many more days do we have before we're shut down? Any conversations I've had with the governor's office, I think he's reluctant to shut down the economy again like we experienced earlier this year, and that is why he put these metrics in place. So that they're intelligent shutdowns and data-driven shutdowns, but instead of just going from one extreme to the other, these color-coded labels are in place, aligned with these metrics, to determine what the right level of restriction or shutdown is. So I'll go out on a limb and say I find that he's reluctant to shut it down again. A total shutdown like we've seen, I just don't see that. But again, if cases continue to spiral out of control like we're seeing currently, who knows? Anything could be possible particularly as we get into the holiday season and people have gatherings at their home, Christmas Eve, Hanukkah, New Year's, whatever you celebrate. That is really going to have a huge impact. If people do the right thing, we can get through the holiday season and avoid a shutdown. If people are careless and disobey the recommendations, then we could have a problem. So I would just pay attention to the data and the color codes there, and you can probably intelligently anticipate what will come next. Jonathan G. I've heard testing is in short supply in Oswego County, and I'm concerned about schools, and if we enter a color code zone, will they be able to test the required amount to remain open? That's a really good question. So the school district is remote until the 11th, which really means then into the weekend, so they can reopen and may reopen Monday. I haven't heard that they're not reopening Monday. So we can plan for that. And what Jonathan's referring to is if we are labeled orange or red, school districts, in order to remain open, have to test, in the case of an orange zone, 20% of students, faculty, and staff. In the case of a red zone, 30% of students, faculty, and staff. And they have to test that consistently to remain open. However, the school district, not me, not the county, not the state, but the school district, the Board of Education, the superintendent, can just say, we better safe than sorry, we don't want to do all that testing and just remain closed. That's totally their call, as you see. That's why they've been closed since I think maybe the 22nd, 23rd or so up to the 14th. So so that kind of lays out the situation. Is there a testing shortage for the school? No. They've been working with the County Department of Health to put in a testing infrastructure, so if they wish to remain open and do the required testing, should we be labeled the yellow zone, or the orange zone and red zone, that they have the tests and the infrastructure necessary to do that testing initially. Hopefully they can sustain that for a prolonged period of time like it requires. So I hope that addresses that question. Jamie R., when would Oswego get the vaccine? This is a really good question, and it's a popular question right now. That's obviously still in flux. I mean, the CDC and FDA haven't even approved it yet, but it's going to be some time before it gets to the general population. I know the CDC rightfully said, 21 million, the 21 million frontline workers and staff will take priority. The 3 million people who are in long-term care facilities will also be a priority. I think it makes sense that dense areas will probably take priority over rural areas. We're a rural county, as I mentioned. So, you have all that factors. It's too early to tell, but, the message is get used to social distancing and wearing a mask, because it's still certainly weeks out. We shouldn't plan on the vaccine arriving in Oswego tomorrow. One point I do want to make is we're in a good position once it does arrive because of Oswego Health. Oswego Health is perfectly positioned to distribute the vaccine quickly, because they already have, in addition to being located right in downtown Oswego, they already have established relationships with other care providers in Oswego and around Oswego. So there's already that infrastructure set up. They're already, after talking to Michael Backus recently, they've already set up policies and procedures. And I also know that they've already purchased the freezer that's required for the Pfizer vaccine. We all heard it needs to be kept in really cold temperatures with this special sophisticated freezer. And I know they already have ordered that and have it on the way. So, I think I addressed the first part of the question, is when will Oswego get the vaccine? The second part, which may or may not have even been asked, is, will we be ready and what's the plan? We're so lucky. I can't overstate it, and I can't say it enough, to have Oswego Health right here in downtown as a provider offering great service, that they'll be prepared and ready to go once the vaccine is ready to distribute. We'll really rely on them. They'll be a critical key, and I would contend they'll even be probably the lead. So we're in a good position once the vaccine does get distributed and gets rolling. Terry M., I'm wondering why we don't hear about the 7-day rolling average. From the numbers I received from COVID Alert, it seems like we should be in either orange or red. I think I've discussed this one. So thanks for your question, Terry. Diane W., regarding COVID, why is the city promoting in-store shopping? Multiple recently announced programs send a mixed message as people are required to go in stores. I also see pictures of small business owners without masks and the mayor in groups without masks. Live entertainment is also advertised in restaurants in the Pale Times, and I thought that was not allowed. First, you've never seen me in a group without a mask. Why is the city promoting in-store shopping? I think I addressed this earlier, but being the holiday season, we encourage people to stay home and don't go out and try to limit travel and limit the possibility of exposure. However, we know that some people are going to make the decision to go out and shop. What I think is in our best interest is to try to keep them, A, local for economic reasons, but B, in smaller businesses, because as I said earlier, they're actually enforcing the rules where Walmart and other large retail stores aren't, or they're more lax. So I think it's really a dual purpose, and I think they're two good reasons to offer these programs to stimulate the local economy, try to get these small businesses through this really tough time, and then encourage people to avoid other people by patronizing small shops where there's fewer people in them at any one time. So I think that makes sense. I suppose I can understand why some may disagree, but I think it's the best option that's out there, second to just staying home or shopping online. Live entertainments advertised in restaurants, I'll have to check that out. I haven't seen that, but I'm not saying it's not out there. Back to the mask, I don't know what group or I was with or without a mask. You'd be hard pressed to find that. I would just say, nobody has been more outspoken than me about wearing masks and following these guidelines. If you remember back in April, we did a wear a mask video and participated in the New York State Wear a Mask campaign. I've had, numerous press conferences. This is the second town hall. One of the first elected officials in Central New York to do a stop the spread order and ban non-essential travel back in the beginning of the pandemic. OFD and OPD did social distancing details. I don't know any other agencies, certainly in the county, that did that when in the beginning of the pandemic we set up social distancing details and educated people at Lowe's and Walmart and other stores as they entered the store. We did mass distribution drives, giving out masks to people entering those stores. So, actions speak louder than words, and you can check the record on that one. Cindy S., if Oswego County or the city of Oswego are designated a yellow or orange zone because of increased cases of COVID, will you mandate the closing of restaurants in the city for in-person dining? And how will that affect the operation of city government departments, especially DPW, because they plow the roads? As I said, that's a determination that comes down from the state based on those metrics and based on that color-coded graph that I've showed multiple times. I will not mandate the closing of businesses unless the state, through that metric system, mandates the closing. I don't find there to be any real reason to supersede the state in a rush to close down the businesses unless the data using the metric set suggests it's the right thing to do. I think the metrics and the color codes are appropriate, and we'll follow those. City government, we set up the essential employee testing program to address your exact question. Every week, thanks to SUNY Upstate and SUNY Oswego, OFD is administering the testing, COVID testing for our essential employees, water, wastewater, DPW, fire, and police. So if you encounter a fireman, a firefighter, police officer, DPW worker, you can bet that they don't have COVID, otherwise they wouldn't be working, and we're testing them weekly so we know. And that is to ensure that city services continue. The fact is we can't have a shift here at the fire department be out of order. We can't have a shift at the police department be out of order. We cannot have DPW employees not show up to work because they're quarantined or positive. So the testing allows us to identify positives, pull them out of the workforce to protect the rest so that we have enough people showing up to work every day to administer the services that you expect, including snowplows. Ann M. says Onondaga County shares hotspot hospitalizations, as that is what the governor says would put us in a hotspot zone. What are our hospitalizations and why doesn't the county share them? The county does share them, but they don't share the active day-to-day. They just share the cumulative. And I'll go back. Right there is of 12/1/74. And I do know that back to Oswego Health, that they've submitted the surge plan to the governor as they had to expand their capacity. The main message here is I don't think people should get so hung up on the data about, well, how many are hospitalized today. Are you going to behave differently if there's 6 people hospitalized versus 12? I hope not. To me, that really shouldn't matter. I also would draw your attention to we kind of lost the flatten the curve quote, but if you remember back in the beginning, it was flatten the curve. The curve was the healthcare system, to not overwhelm the healthcare system. So, hospitalizations we want to be as low as possible to not overrun the healthcare system. How do you do that? You do all the things that we've been talking about. That's why I'm here. wear the mask, social distance. If you're exposed or should be quarantined, actually quarantine yourself and don't go out around having a nice time. And I'll take a moment to just say, don't underestimate the impact one person can have. If you just imagine the scenario of a person who should be quarantined or is known positive, or maybe thinks they were positive but didn't do anything about it, showing symptoms, doesn't get checked, was near a positive and didn't tell anybody. Think of how quickly this can happen. They go out and have a party with their friends Friday night, or go to a family gathering Sunday for Sunday dinner, and expose their family, including an elderly grandparent or parent. While that individual may not require hospitalization or even even really need treatment beyond quarantine, the senior citizen may. And that is one bed that a reckless individual just occupied, if the senior citizen requires hospitalization, that now is an occupied bed. And if our local healthcare system gets overrun here, we have to rely on Onondaga County, who's already having a tough time with hospitalizations and capacity. So we're all linked together, and that one quick scenario that I just tried to get through, I think should highlight just how big of an impact one person can have, particularly a careless or reckless person. So I hope people realize that. Kelly W. I'm a therapist in substance abuse clinic. I work with people who've done amazing work. Most are employed full time. While I love the beautiful new buildings, this seems to be not a COVID-related question. While I love beautiful new buildings with new apartments, why isn't more housing being offered for families as well as affordable options? All the available rentals are college or luxury. So it's actually a good question. If a affordable housing unit or lower income unit is being built, people say, oh, we don't need more affordable housing. If a nice, luxurious apartment unit is being built, people say, who can afford that? So, it's goes both ways, I guess. I would say that there are two developments currently taking place that address working class and lower working class, anywhere from $30,000 to $60,000 in income for a family of four. That's down Harborview Square, Midtown Plaza. So I think we're really, the folks you're talking about here, we're addressing the need there, and I agree there is a need, because landlords in this town for way too long have tried to accommodate college students because they can charge enormous rents and offer low quality housing conditions. Or they've charged astronomical rents and still offered low quality housing conditions. So that's certainly a problem. So I agree there's the need, but I would contend that we're filling the need on both ends. We're offering quality units downtown where people who work at Oswego Health and Exelon and Novelis can finally decide to move to Oswego because they feel there's a place for them when before they didn't. And then secondly, the affordable portion, I think we're accommodating that need too, and there certainly is one. Joe H., good afternoon. I would like to know why there haven't been a COVID site set up to get more people tested faster. It's so backed up, you can't get in. A lot of other city and states have them. So I think he's talking about the drive-through testing, which I would really like here. The county administers those. I certainly think there's a need. Again, I mentioned the shortage of test kits nationwide earlier, so I'm sure that has a role to play. And then it has to do with budgeting. I think drive-in testing centers are helpful. I know earlier in the year there were two of them. I think one was in Hannibal and one was in Fulton. So the city, the densest area, didn't get one. But I wish there were more. And I know that testing shortage is an issue. Maybe funding's the other issue. But I think it'd be a wise investment and well worth it. So, we can, that's led by the county and the state, but for what it's worth, I would love to have a site here. Next person, under the name they just said C. It's not a question, but I think we need to do some education and promoting to encourage people that when the vaccine becomes available to take it. I find it very disturbing that some folks do not want to get a vaccine. The vaccine will only be effective if everyone who can gets it. Good point. Rosemary, how many COVID patients are hospitalized at Oswego Health? Don't know the exact number at Oswego Health because it's really not relevant to the general population. You should be working to try to limit hospitalizations and change the behavior of the virus. As I said earlier, it's 74 hospitalizations. That's the cumulative number since the beginning of the pandemic countywide, not Oswego Health. You really shouldn't act different if 12 people are hospitalized today. Are you going to act different than if 8 people are hospitalized tomorrow? I hope not. And the job is to flatten the curve, and that's to have as few hospitalizations as possible. Karen B., given the steady number of active COVID-19 cases, why are we not offered free symptomatic testing? I think it is likely that people who are asymptomatic are unknowingly spreading the virus. Onondaga and Cayuga counties offer testing for asymptomatic. At one point, all right, so this is exactly what we just mentioned. Certainly we'd like asymptomatic testing, and hopefully county health, state health is working on setting up more sites because I think it's helpful. Kathy N., there are comments that OPD is not wearing a mask during traffic stops. Where are our numbers currently, and what's the threshold? I think we covered that as far as OPD goes. I can help out. They should be. It's our policy that they have to be wearing masks. I know that if they suspect alcohol is involved, they'll drop their mask to do their own quick investigation there, but they should be wearing masks at all times. Feel free to send me a photo if you think they aren't. And the last submitted question, and then we can get to some online questions quickly. Bridget H., the status of yellow as per our numbers, we should have been yellow 2 weeks ago. Numbers are going up. People refuse to wear masks. What can businesses do? People get aggressive. Walmart doesn't like to clean. They used to. We've complained to the county, but nothing gets done. Okay, great. We've covered that. I think I talked about the metrics, the yellow. I think what's saving us is we're a rural area, and there's some other metrics that are relatively new that we talked about. So I think I covered this. And again, Walmart, if we could Walmart management, but they'll pay more attention to the amount of people walking in and out of their stores and buying or not buying. Take some questions here that some people wrote in on the comment thread. Good one. I wanted to cover this one. When is the parking ban going into effect? By law, it's December 1st, but we don't really follow that because the council gave me the authority to put it on as I see fit as the conditions change. There's really no point on putting the parking ban on December 1st just because it's the law, says so. I usually wait until there's snow on the ground and it has accumulated on the ground and is going to stay there. And then on top of that, when there's snow forecasted. So there's no parking ban now. I would just say, if you see a big snowstorm being forecast or you see snow accumulate and another snowstorm's coming, it's a safe bet that I'll put the parking ban on. Other than that, I would just say enroll in our alert media. Go to Google, type in Oswego alert media, and you can get text right to your phone when the parking ban's going on. Or watch my Facebook and Twitter, and I'll be sure to post that. And whenever we put the parking ban on, we always give a 3-day grace period, so you don't have to worry about not knowing, because we'll give you a warning on your windshield if you're parked on the road after the parking ban goes into effect for 3 days. So keep a lookout for that. Who determines when we move zones? Again, that's driven by state government, and it's driven by the data that is produced through our behavior, right? So that's not a decision I make. The metrics are set, the codes are set. It's just a matter of where our data places us, and the governor in New York State would make that determination. I would like to think they'll give county or me or somebody a heads up that a determination, you'll enter a yellow zone on, let's say, hypothetically speaking, Sunday. and we don't just wake up one day and find out we're in a yellow zone. So they make that determination based on the metrics, based on our case data, which is based on our behavior. If you want to not have to worry about this and avoid the color-coded zones and the restrictions and lockdowns, then do the right thing and socially distance, wear masks. Jody G, is there an expiration date on the $25 gift card? Yes. It's a promotional program, so we put an end date to end the promotional program, just like stores do on basically every sale that there is. And it expires on December 31st. And the reason is the goal of this program is to get people to support local businesses this holiday season. Touched on this earlier. It's a safe bet that people are going to be shopping in one way, shape, or form. We would encourage them to try to stay home, limit their trips to the store. But if they do go out, avoid shopping malls and avoid big box retail stores. It's the healthiest option, but the smartest option or the best option for our economy, local economy, is to support small businesses who can't endure another shutdown and have already had an extremely challenging and difficult year. So the goal was to get these gift cards used during the holiday season and get people to support local businesses to avoid malls and so on. And we put that on December 31st. It would also be a total accounting nightmare if we ran a promotional program that never ended. We have more, that's it. I have one last question. Actually, this is a good question to end on. Has it been an hour? Is it 8:30?
It's 8:30.
Okay. Oh, we're right on time. All right, last question. What was your favorite part of the Santa slow roll? My favorite part of the Santa slow roll was seeing the faces of the kids when Santa Claus drove by. You know, our kids have been robbed of so much because of learning remote and the shutdowns and so on. And you could just see it in their eyes that this was an occasion and it was a real special treat that they got to see Santa. And you know, we've tried really hard. The Economic Development Office and Youth Bureau specifically have worked really hard to get creative, whether it's the Read It program to encourage reading outside of school, whether it's the chalk walk back in the spring, the drive-through trick-or-treating for Halloween, or the Santa slow roll and all the holiday programs, and the Christmas tree lighting going remote was a really neat experience. You know, I think people recognize and appreciate it. You know, some municipalities have just canceled this stuff altogether and haven't offered extracurricular activities, socially distanced or not, and we've tried to make a serious effort to do that to keep kids engaged because we're aware of just how much they're really losing out on. So it was seeing the faces of the children as they saw Santa, and it was just a nice, we got to see Christmas decorations. So it was a nice event, and you know, we're trying to leave it open-ended. We may keep this event around post-COVID because I know Santa had a lot of fun. The kids liked it, and I enjoyed it. So we'll see. We'll continue to get some feedback, but it seems like people liked it, so maybe we'll keep it around. Unless there's a last question that popped up, we've used our time that we set aside. I'd like to thank everybody for tuning in. I hope this was helpful. I hope that I was able to clear up some of the confusion and clarify some things that people had reached out to me about, and that I felt there was a consistent element of confusion on some topics. So I hope we cleared some of that up. I'd like to thank you for tuning in, and again, just please do the right thing. Don't underestimate the impact a single individual can have on the entire situation. We can talk about the rules and the restrictions and the social distancing and the good practices, but safe practices, but we need all 18,000 Oswego residents to do it. If 15,000 do it and 3,000 don't, we're not going to get too far ahead. So we really need to be a collective effort, a community effort. And I'll close with what I've been using as a pitch, an elevator pitch to everybody I see or talk to. If you're not worried about your health, and you're young, you're healthy, you're not worried about it, COVID's not going to do anything to you, then don't worry about your health. But it's not about you. You should worry about others and the impact that your behavior, your actions, your movements can have on others, particularly the vulnerable, the immune compromised, senior citizens, elderly, frontline workers, first responders, the list goes on and on. They're all in a different situation. And this virus can have a greater impact on them than it can on you, and you may not even know that. But you need to take others into consideration and worry about them, if not for yourself. And if you don't care about yourself and you have no consideration of others, then at least do it for the local economy and to avoid more restrictions and more rules that you hate so much, and more lockdowns and shutdowns, because if we don't correct the data, that's where we're headed. And I'm really concerned that a lot of the work we've done these last 5 years can be lost if we enter another shutdown or have to experience tighter economic restrictions. So that is my 30-second elevator pitch. You know the rules. You know what to do. It's just a matter of if you're willing to do it and participate in this community-wide effort. So I hope you do. I hope tonight's information is helpful and encourages you to